Hello everybody, I am Dr. Fernandes Melo from Brazil, and my speech today will be about hair procedures part 2. Once again, I want to thank Dr. Stephanie Leclerc-Mercier and Maite Iglesias and all Vichy L'Oréal team for the kind invitation. The topics today will be microneedling and MMP. Starting with microneedling. Microneedling is a percutaneous collagen induction with needles, and what would be the rationale of the use of microneedling in trichology or alopecia? We know that microneedles generate small damage to the skin, which release growth factors, activate stem cells, and stimulate new collagen. Of course, I want to say thank to Dr. Emerson Lima and Dr. Mariana Lima, a great couple and great friend of mine. They wrote books and articles about this topic, and because of them, we know that 1.5 millimeters is the best length of the needles to reach the scalp. Of course, we know that there are different devices with needles of different lengths and thicknesses. And we intend to reach this super red endpoint, as we can see at this image, clinical picture. We can also see this image under trichoscopy. And sometimes we know that microneedling can be painful, so we do recommend injectable anesthetic block. We can start with the supratrochlear nerve, and after block the supraorbital and the zygomatic temporal, going to the auricular temporal, and finally to the occipital major. This is a before and after picture of a male case of androgenetic alopecia treated with microneedling. We can see the improvement of the hair density, and here we can also see in another case, this one is a female pattern hair loss, and we can see the improvement in the parting line of these women. Highlighting the contraindications, we know that active folliculitis or other local infections are contraindications for microneedling, as well as inflammatory scalp diseases such as psoriasis or eczema. And pay attention to the patients with blood dyscrasia or undergoing anticoagulant therapy. Unfortunately, we don't know exactly the number of passes and also the frequency of application, and the ideal number of sessions still need to be established. Our protocol here is starting with this scalp asepsy, and after go to the local anesthesia and or anesthetic block. We use this roller with 1.5 millimeters, and we perform multiple passes of the roller on the scalp, and you can use or not drug delivery, and we recommend 4 hours without washing after the procedure. About drug delivery, if you want to use it, we recommend sterile minoxidil or dutasteride. But the question is, does it optimize the therapy, or it does not penetrate into the skin through the barrier made by blood crusts? We don't know yet this answer. So moving to MMP, that is the Portuguese acronym for microinfusion of medicine into the skin, that was developed by Dr. Samir Arbashi from São Paulo, Brazil. We know that MMP is the combination of microneedling and mesotherapy at some point. It is a technique similar to a tattoo, but with the use of injectable medication instead of ink. We use this Cheyenne machine here in Brazil, but the intention is not to tattoo the scalp like this. It's important to highlight that Cheyenne machine is registered at Anvisa, that is our regulatory agent similar to the FDA in the United States, and we prefer this 27 needle device to androgenetic alopecia. These are the needles used for this disease. And to perform MMP, first we start with this asepsy that is similar to mesotherapy and microneedling. The suggested machine speed is 60 rotations per minute. The application is in parallel lines and at 90 degrees, and the endpoint is obtaining a mild erythema, not similar to what I showed before in microneedling. When comparing mesotherapy to MMP, it's important to know that liquid volume is much bigger per point in mesotherapy, and we have less drug with more homogeneous distribution in MMP. Drugs used are the same as mesotherapy. There may be pain, but not to the point that injectable anesthesia is required, as in microneedling. But as in microneedling, you must be careful not to break the hair shafts. Here I am showing to you a before and after photo of MMP treatment for a female patient with female pattern hair loss. We can see the improvement after 6 months of therapy. And we published this article in 2022 together with Professor Tosti and Dr. Rita Cortez, that is called scalp microinfusion, a novel drug delivery technique for hair loss treatment, explaining better the use of MMP in trichology. And this is another suggestion of reading published in 2022 in the Journal of Cosmetic Dermatology that is called Minimally Invasive Procedure for the Management of Female Pattern Hair Loss. And I want to say thank you one more time to my team here in the State University of Rio de Janeiro in Brazil. I say thank you to everybody, merci, obrigado, and I leave you with my email and my Instagram if you want to make some contact. Thank you, have a great day.